Hey, welcome everybody to episode 10 of Two Doctors Tell the Truth. If you've listened to us before and you like us, please follow and subscribe. It's totally free information based on our studying and research. So today's episode, which I'm really excited, I've wanted to do for a while, is going to be on stem cells and PRP, something that everyone knows about, I would think. A lot of controversy. And in the plastic surgery world, I can talk at least about PRP and I guess some of the stem cells. So let's break it down, Mike. I've been wanting to do this for a while. So
Yes, you have. Yes, you have. See, you notice everybody, this is the first episode he smiled on.
you think so? I think I smiled on one other one.
But this one you wanted to do so bad, and I kept putting you off. You're just like, when can we do it? And I'm like,
Yeah, I'm excited about this one. Let's start. Why don't we start with PRP first?
yeah,
Uh,
I agree.
since that's more common. I guess I can start with that. So that's what we call hemopoietic transplant or a blood-borne blood plasma. So what we do, right, with PRP is we draw your blood, we spin it out to get the platelets. That's the P in PRP, platelets, right? And once we get your platelets, there's a special agar that is in the test tube that makes more platelets. So it gets all the platelets out. Now there's different companies and some say they get more platelets than others. But so anyway, once we get the platelets, then we can inject them locally. Okay. And there's certain areas, which is very odd, where they work and don't work. But I will say the literature is new, still early, and ambiguous. Would you?
Negative. The literature is definitely, unfortunately, it's more negative than positive.
Yeah.
And which is surprising to me because I personally think PRP, certainly because it's from yourself, there's little harm. The only downside of it is price, cost. We'll talk about the literature, but you're absolutely right. I think there's only a couple things where there's actually even any data to show, but then they say very low quality data, even for those.
Yeah. So I'll tell you a few of the things that I know for plastic surgery is hair definitely increases density of hair follicles and increases hair count. So I do that in my office, definitely works, and I can attest to that. I have hundreds of patients and really good photos. So I can tell you it works for that. The in the phase 2 long-term data, I don't know exactly what it does. There's not a lot of information about that, but certainly patients are extremely happy with it. Is there some collagen growth there? Seems to be, but once again, I can't tell you 1,000%. There's no great papers.
Right.
Now, that's the cosmetic applications.
Right.
As far as the orthopedic world, injecting it, very interesting, injecting it into muscle injuries, tendon injuries is very big, common. We know for a fact some sports teams do it, some sports teams don't do it.
Yeah. Like I told you this weekend, one of the Rams trainers is my patient friend. And I actually called him last night. The Rams, I asked him if I could say this, but the Rams don't do it. The orthopedic surgeon for the Rams are the most famous orthopedic surgery clinic in the world. Curlin Job, Frank Job actually invented Tommy John surgery. He's the first one who did it on Tommy John, and Curlin was Sandy Koufax's doctor. So, they did Aaron Rodgers, they Shohei Ohtani, they do everybody. But operatively, short of there's one surgeon there when they do a patellar tendon injury repair. He injects PRP with not knowing if it'll do anything. But as a group as a whole, Mike, they don't use PRP for any tendon injuries or muscle injuries. Is it like across the board as a group?
Which is real interesting, right? Because a lot of orthopedics do. So I would say that it's 50-50. So a lot of orthopedics say it does nothing. I've had orthopedics tell me it doesn't do anything, and there's no literature that shows it does anything. Then I have orthopedics that say, I'm not sure if it does anything. My patients seem to think that they heal quicker and there's no downside. And then I have other orthopedics that swear by it, that say, yeah, it works, cuts down inflammation. Is it better?
Well, no, but we know we know is in terms of an anti-inflammatory. But you know what the literature says? You need 4 injection over 2 months, and is a cost of $3,000 or $4,000 worth when we know it works for inflammation? Because the studies, and I looked and I sent you the same thing, a systematic review of all the studies in terms of tendon injuries have not demonstrated clear and convincingly that it reduces pain, it increases function, and there is no evidence in any study where there's radiologic evidence of tissue healing. So, guys, when they inject it in the knee and you hear, oh, it's going to rejuvenate your cartilage, there's no study that ever shows that it's done that.
Correct. No, correct. I think there's some studies that show it decreases pain and decreases length of recovery. But it's interesting. There's some studies that show that for the elbow, but then there's a study on the Achilles tendon, and it says it does nothing.
And the glute, isn't that weird? You saw that study where it was like
Yeah.
the gluteus, so
Yeah.
your butt muscle, the middle one, because you have 3, but it's okay.
And I know they're using it. They're using it for hamstring pulls and muscle pulls. A lot of professional sports teams. I think that the rub here is there's very little chance of any complication, probably 0.1%. So outside of the cost, because I don't know if a lot of these are covered, I don't think they're covered.
None of them are.
Right.
I have PRP when I tore my scapholunate ligament
Right.
in Philly, and the surgeon is the most world-renowned wrist surgeon in the world. I flew to Philly. He put it in when I had surgery.
Yeah, they do
And
have.
he's the team physician of the Eagles.
Yeah.
Philly. And I was like, Lee, what do you think?
Yeah,
I'm operating. Take your blood. I'm not going to charge you for it. Nobody's going to charge you. It probably won't help, but it's not going to hurt.
Yeah. So I think that's where we are at PRP. But I'll tell you, right? Knowing everything I know, reviewing the literature, if I had a tendonitis somewhere, I'm doing PRP. I just am. So,
Right.
everyone you can say that there's no downside. Do we know it works? The literature is ambiguous, right? Because we do know that platelets release cytokines and cytokines help tissues heal. So
What I didn't know that I actually learned, because I would imagine that since so many guys who are not MDs are doing it, that if you give local anesthesia first to numb up the area and you give it in that area where you gave local anesthesia, it'll nullify the effects of the platelets. And I'm quite sure that people don't know that, right?
yeah, and also you don't want to be on aspirin
Right.
products right before you do PRP, because aspirins, what do? Inhibit your platelets.
A lot
So
of platelet inhibition, just like non-steroidals, Motrin, Advil.
sure, aspirin does more of it. But so you don't want to be on that if you're going to go get a PRP treatment. But if anyone's listening, you got tendonitis, or if you're having surgery and they recommend to put it in, I would say do it.
Exactly. As long as it's not an exorbitant cost out of your pocket, I have no issue with it.
Okay, so that's PRP. Let's move on to stem cells. So this is a really exciting field, really exciting, because the potential here is huge, right? And there's clinics all over the world for stem cells. So why don't you talk, Mike, about the different types of
Well, right. Okay, so stem cells, I'm going to mention them, but we're going to talk more for musculoskeletal and other stuff. But
longevity.
predominantly what stem cells, like when I think of it as an MD and a physician, is people who have leukemia or lymphoma, and they give you chemotherapy, and then they completely ablate your bone marrow. In other words, they destroy your bone marrow. You have no blood cells, and then they give you stem cells from umbilical cord or whatever and repopulate your bone marrow with healthy. When you hear about that's a stem cell transplant for multiple myeloma, for leukemias, lymphoma. So when you hear stem cells transplant for cancer, it's the same concept, but it's much different. Those work. Okay.
Yeah, so those work, and those are approved for leukemia, lymphoma, multiple myeloma, sickle cell disease,
right.
some spinal cord injuries. Now, let's explain to people so they know. So this platelets PRP is different. That's coming from
Right.
platelets.
Right. So stem cells
that can be taken from your bone marrow,
correct.
fat cells, so we can harvest fat. And then we can also do cord blood from umbilical cord, or also the placenta.
Right. Embryonic stem cells. And that's where, at least in the United States, a lot of the controversy comes from using embryonic stem cells, because a lot of people are misinformed and they think they take abortions and they use the remnant, and that's not what it is at all. Okay. In the United States, for the stem cells, not that we're talking about for cancers and things, the stem cells that they use are either harvested from your bone marrow or your fat.
Correct.
Okay. That's in the United States. We'll talk about what they may or may not do in other countries because it's shady.
Yeah. So then they take out your bone marrow or they take out your fat, and then we can give agents to multiply those stem cells into the quadrillion.
And you inject it directly into, let's say you have a tendon injury or a muscle injury. However, again, the American Academy of Sports Medicine and the American Association of Orthopedic Surgeons, nobody recommends it. Like there's not enough high quality data to show that it works. Different than PRP, stem cells. So there really is nothing to show that it regenerates anything. It's, even though there's stem cell clinics in the United States, that's why so many people go to foreign countries, because they go for different reasons. They go for COVID, because like we were talking, a lot of these clinics have marketing gimmicks and it'll cure everything. But in the United States, for outside of a clinical trial, the only thing that people really can be trying it for is muscle or tendon injuries, but there's no data. But for Parkinson's and things like that, it's got to be done in a clinical trial.
Yeah. So either it's not FDA approved in the United States for a lot of the stuff that people want. So like for knee cartilage, so you don't get a knee replacement, for longevity, for inflammation, just because you don't feel good, for stuff like that. So in the United States, unless you're in a trial or have an investigational study, and there are a few around the country, you can't do it. So that's why people are going to Mexico, Costa Rica, and the people that are going there are usually getting injected if they have an area that bothers them, but they're also getting them put back intravenously. And the thought is that those stem cells go to wherever it is in your body that needs it and helps repair or regenerate.
And that's to speak in Spanish, that's no bueno.
It's not FDA approved. It's investigational. So there are people that have gone to these clinics and swear they feel better. Once again, we try and base everything on evidence and studies. Listen, would it be great to have someone that's paralyzed and we give it to them and it goes to their spine and fixes their spine and they walk again? Or someone that has Alzheimer's or can't speak from a stroke and we give it to them and it repairs their brain? This is all the hope. This is all the stuff that works. Someday that works, right? But currently, there's nothing that shows that it does that.
And my concern is, let's just talk about what we do in the United States. An absolute, first of all, can't be done in pregnant women. You always got to remember that. Pregnancy can't be done. It cannot be done if you have an active malignancy or you're in remission from a cancer, because harvesting it from your bone marrow, your fat, there have been cases where you're auto-injecting cancer cells that you don't think exist into another area of your body. Okay. So it's happened. So that's in the United States. The problem that I have with going anywhere in Mexico is, as I told you, there's a recent report of 3 different. So Mexico, I think they're using umbilical cord and all that stuff from other people, because there's just now a report of 3 people from different clinics in Mexico that had Mycobacterium abscessus. So Mycobacterium, for everybody who doesn't know, is a different species, is the same bacteria that causes tuberculosis. Okay. And it's wicked. Like, one of the patient is in Denver. They have probably the best lung hospital there in the world. And it's you can't have a worse infection than a Mycobacterium infection. So they were all infected by given IV stem cells in Mexico.
Yeah, you got to be careful, right? They don't have the same conditions that we do. And it's just the fact that there's no malpractice in most of these places.
Right.
People run a little roughshod. But for example, there's a phase 3 trial pending in the US right now for Crohn's disease, lupus, and multiple sclerosis. That could be great. That could be awesome. right? So there's a lot of good work being done. But I say currently, if you don't have a condition that it's FDA approved for and you want to just go for longevity purposes, or you just don't feel well, or you have an injury and you think, hey, let me go to Mexico and because I can't get it done here. You know what? Like we talk about, there's more of a risk there because of maybe not the best ideal conditions, like Mike just said, but also you're probably just wasting your money.
I wouldn't go. I would be so scared of hepatitis, of HIV, of of cancer. If you don't know where you're getting it from, I just there's like I said, if there was one in 1,000 chances if I was paralyzed that it may make me walk, yeah, that's all. But we're not there yet, as you said. This is all in infancy.
A lot of this stuff is investigational and extremely exciting, but I do think stem cells are definitely the part of the future. And I think we're early on, and hopefully there's more and more research being done. And I feel if you know the risks and if it's a last resort kind of thing, like I know some people that have gone, and if it's, hey, people can't figure out what's wrong with me, I just don't feel well. Or I know a lot of professional athletes that have gone because they're just not healing fast enough, or and that's your livelihood and you're willing to spend the money. You're making millions and millions a year as a pro athlete. And you say, hey, I'm going to go to Germany and get stem cells. And
I may feel more comfortable in Germany than Mexico, but be as it may, I just like I have a crazy friend who's an actor who was rescuing dogs in the fire in Pacific Palisades, and he's convinced he has lung injuries and he's inhaling stem cells. He has pictures on the on his Instagram, inhaling stem cells and getting stem cells in Mexico. And text me, what do you think? And I'm like, you're crazy as usual, but whatever, you're going to do it. And like you saw, the data shows really in all the trials that they've done, and they are low quality trials, it's no better than placebo because so many of this stuff is, if you can't measure it, they're observational studies. You're asking a patient, how do they feel? And if the person tells you they feel better,
yeah,
okay,
exactly. And
positive result.
the takeaway, I think, is that FDA approved stem cells in the United States is limited to blood transplants and certain therapies for sickle cell, some other ones, but the majority are investigational and still being studied. And you know what's funny here too? And it's just so almost hypocritical is that the same people that come after big pharma are now saying, hey, the United States doesn't want to do this. That's why I'm going to go to these other countries and they're keeping it from us or whatever. Well, don't you think big pharma would want to make money on stem cells if they could figure out a way to do it? So there are a lot of phase 3 trials going on, which is like we talked about 7 to 9 years. So hopefully soon in the next few years, we'll get some stuff that's approved and shown that it really works.
Speaking of big pharma, I related to the last podcast. So I thought I'd share this. So I learned, I sound like some conspiracy theorist, by a good source last night. I didn't realize that a lot of the supplement companies are actually owned by big pharma. So if,
Oh, I'm sure.
okay, but so that's what the joke is. Like the people who are on the inside are like, all these people think, oh, it's a big pharma. Like we're making money either way. You know what I mean? And if berberine really cured diabetes, yes, we're Abbott. We own this company. Don't you think we would make it? Or we're AstraZeneca. Don't you think we'd make it? So at the end of the day, I mean, I just thought it was pretty funny because we're sitting there because you saw one of the comments from the last podcast. Somebody put down the supplements. It's the quality that matters. And my response to her was, that's the whole point of our podcast. You don't know the quality.
Yeah. Yeah.
You know?
So everything we talk about, we like, and we started 2 months ago. We want to tell you the truth. This is what we found, right? So the truth, investigational works for some things. If you want to go outside the country as a last resort, or you have the money and you're okay trying it, you're probably not going to be harmed.
Right.
Chance of getting infection is low, although you could happen. And then, so that's that. And PRP, we both say try it, even though the studies are also ambiguous on it. But PRP, less likely to have any issue at all. So with that being said, great podcast, Dr. Richman, as always. Hope one person learned something today, and we did our.
Exactly. I enjoyed this. And Dr. Fiorillo said, please, if you go to our Spotify, click 5 stars. If you go to YouTube, subscribe. And you can follow us on TikTok, 2 Doctors Tell the Truth, or on Instagram, 2 Doctors Tell the Truth. And I try, I know Mike does too, but I try, if somebody puts a comment down, I usually try and answer it.
Yeah, send your questions, your comments. You have anything you want us to talk about, put it in there and we'll research it.
Yes.
The websites will be coming up soon, and we'll start being able to put up our papers that we're looking at and referencing, if that helps you, and we'll put our resumes and other stuff on there as well. So with that being said, nice podcast, and we'll see you next time.
Okay. Have a great day, everybody. Thanks.